Have you ever heard of these bizarre mental disorders? If not, let's dive into the video. Number 1. Multiple personality disorder or dissociative identity disorder. A person having more than two distinct identities, each with its own way to perceive the environment and their self. Their persona controls their identity at different times. These personalities are so distinct that they even have their own names, act, history, or even fashion style and preferences. Repeated childhood trauma can interrupt personality development and create other personalities. These made-up alter egos help the patient cope with the painful traumatic experiences. People with dissociative disorder have difficulty coping with emotional stress. They have a sense of being detached from themselves and their emotions. Number 2. Obsessive-compulsive disorder. It is defined as a consistent chase for perfectionism, orderliness, and a need for pervasive interpersonal and mental control. Do you know someone who is so obsessed with perfection? They are so devoted to getting the work done, to the point of neglecting social relationships. The patient performs a repetitive ritual that fills their day, that normal routine becomes impossible. The common signs for the symptom disorder include the repetitive urge to reorganize, clean, rearrange, and check if everything is in order. Not giving in to their compulsions causes significant distress. Number 3. Histrionic personality disorder is when people with this personality disorder usually present dramatic and erratic behavior to gain attention. These people are self-centered and pay too much attention to their physical appearance. Their mental image of themselves is distorted. They gain their self-esteem from the approval of others. Though normal functioning in society is not affected by this type of disorder. But sometimes the manipulative skills of these persons with HPD can affect interpersonal relationships. People with this disorder are overly sensitive to disapproval and criticisms, acts dramatically in front of a crowd, but with lacking sincerity, exhibits inappropriate flirtatious behavior, and they are self-centered and does not care about others. Number 4. Autocannibalism. Now we're getting into the freaky areas of psychiatric disorders. It is a mental illness that is usually portrayed in horror movies, but it exists in the real world. Freaky? Wait till you learn that some of the symptoms of this disorder are being practiced by some people as a habit. Yes, you heard it right. Nail biting and chewing on the dead skin of your finger is a form of autocannibalism. Extreme versions of this disorder include eating one's skin scabs, hair, boogers, poop, and bodily discharges. Like OCD, it also involves impulse control and is linked to depression and anxiety. Cognitive behavioral therapy together with aversion can help with this kind of disorder. Number 5. Alice in Wonderland syndrome is diagnosed through the presenting symptoms. This disorder is characterized by distorted visual perception, or also known as metamorphopsias. It is a related disorder with the movie Alice in Wonderland, where Alice changes in body size by eating a cake. IOS is a condition of visual hallucination, is the perception of one's body size, color, and shape, loss of limb coordination and sensations, distorted sensory perception. Hallucinations involving a group of animals is the most common signs you might have it. Number 6. Alien hand syndrome is another rare disorder where the people's hand acts differently and out of their control. It's as if their hand has a mind of its own. Alien hand syndrome is characterized by purposeful but involuntary movement of the hands. Some people who has it claims that their hand will try to drown or stab them. Experts are still trying to find out how to cure the symptoms. This bizarre behavior is related to disturbances of brain function, especially when the right parietal lobe is damaged, which is the area of the brain that controls planning and spontaneous movement. The most common symptom of this disorder is the inability to control hand actions. The limb is considered a foreign part of the body. Number 7. Capg syndrome is an illusional disorder where people experience an irrational fear that a person they know is replaced by an imposter. They have this unshakable delusion that the person that they used to know becomes suddenly unfamiliar. Often occurs to the people with neurodegenerative conditions like dementia and Alzheimer's disease. Also happens to people with bipolar disorder and schizophrenia, and is caused by structural brain injuries with neuroanatomical damage. Unfortunately, there's currently no cure for Capg syndrome, and even treatment can be challenging. especially if a person with this condition has another mental disorder that has been linked to the condition. Number 8. Apotemnophilia, or also known as body integrity identity disorder. It is another neurological disorder, where the patient has an overwhelming desire to surgically cut away a healthy body part. Apotemnophiles will usually find it difficult to get a surgeon to willingly amputate a healthy limb. But these patients are so desperate that they will attempt extraordinary ways to damage the limb. They would crush a leg on the wood chipper or lose an arm with a chainsaw just to get rid of the unwanted body part. OMI researchers found a link between apotemnophilia and inappropriate sexual behavior. Some patient considers their unwanted healthy limb as an erotic object and wanted it removed. Most people with apotemnophilia are almost always been sexually attracted to amputees. I'm sorry to say this, but if you feel desire to do so, you possibly have apotemnophilia. Number 9. Cotard's delusion was discovered by a French psychiatrist in 1880. Cotard's delusion is one of the scariest mental illnesses that ever existed. This is also known as the walking corpse syndrome, where the sufferer believes that they are deceased or dying and out of existence. Studies show that patients suffering from this disorder would refuse to eat or take medications. Some would even report having auditory hallucinations telling them that they are already dead. A case study of a man in Cajamarca was admitted after his reports of seeing blurred faces of dead people telling him that he was dying. The patient refused to eat, saying that the food is rotten, and wanted to see a priest confess his great sins. Number 10. Stendal Syndrome is considered as one of the most peculiar conditions among other mental disorders. It is characterized by the feeling of being anxious and confused after being exposed to a large amount of artwork. In extreme cases, the patient even experiences psychosomatic symptoms such as heart attack and hallucinations. The main symptom of this disorder is the altered sensory of colors and sound. The patient has an unexplainable sickening feeling with beautiful art. Example causes dysautonomic symptoms such as tachycardia, diaphoresis, chest pains, and loss of consciousness. All of those mental disorders are not a joke. People suffers daily because of those mental disorders, therefore people should take this video seriously. This video was made for spreading awareness.